Next, we will study about the blood pressure. So first of all, you should know about some terms like heartbeat. So what is heartbeat? One complete contraction and relaxation of the heart is known as the heartbeat. Okay, and heartbeats, it ranges around 70 to 72 times in a minute, but it can be increased to 100 times per minute when you do physical exercise. So during physical exercise, the heartbeat, it became faster. Now next is stethoscope. What do you mean by stethoscope? All of you know, I think, that an apparatus which magnifies the sound of heart beats. Now what is blood pressure? Blood pressure means the pressure at which blood is pumped around the body by the heart. Okay, means the pressure at which blood is pumped around the body by the heart, and it is expressed in two values, one that is systolic pressure and one that is the diastolic pressure. So what is systolic pressure? Systolic pressure is the maximum pressure at which the blood leaves the heart through the main artery during the contraction phase. Okay, during the contraction phase, when at maximum pressure the blood leaves the heart through the main artery, so that is known as systolic pressure. And diastolic pressure means the minimum pressure in the arteries when there is relaxation phase in the heart. Okay, so when contraction phase is there in the heart, so that pressure of the blood, that is known as the systolic pressure in the artery. And when during the relaxation phase of the heart, the pressure, that the minimum pressure which is present in the arteries, that are known as the diastolic pressure. Okay, so these are the normal values, that is systolic pressure 120 mmHg, millimeters, mm it is representing here millimeters of mercury, and diastolic pressure, that is 80 mmHg. Next is this Figma Manometer. Now what is Figma Manometer? The blood pressure, it is measured by using an instrument called Figma Manometer. Okay, now low blood pressure. Low blood pressure, it is, this condition is also known as the hypotension, and high blood pressure, it is also known as the hypertension. So low blood pressure, it can cause fainting, dizziness, because the brain that doesn't receive the enough blood. Okay, because the pressure of the blood, it will be very less. So because of that reason, the brain, it doesn't receive enough blood, and this condition is caused by, or caused during the several conditions, means several situations, during pregnancy also, thyroid, if suppose if anybody having thyroid problem, diabetes, depression, heart failure, etc. So there maybe there so there will be having chances of the low blood pressure. Now next is high blood pressure. High blood pressure, this condition, it is also known as the hypertension, and it can leads to rupture of an artery because of the high pressure, and leads to an internal bleeding. Okay, and it is caused by the narrowing of very small arterioles, which results in increased resistance to blood flow. It can be caused because of these situations, because of the smoking, being overweight, lack of physical activity, stress, older age, family history. Means that if suppose the parents or the grandparents, they also have the same situation, means having the high blood pressure, too much salt in the diet.